Hi, guys, it's Dr. Sadaf, and I would love for you to like and share this podcast and make sure you leave me a review. I'd love those 5 stars. So please, when you send me a review, please make sure to put the 5 stars in and to share the episode with somebody that you know that could really use it. And I would absolutely appreciate it. Also, if you're looking to schedule an appointment with me, make sure you go to my email and put your name on the email list. You will be the first to know when I open up my office in spring of 2024. It's drsadaf.com. And last but definitely not the least, September 16th to the 23rd, 2024, I will be hosting a retreat with Dr. Basma Faris in Morocco. You will be getting yoga and coaching, and we'll be doing excursions and cooking and spa and hammam and all of that great stuff along with meditation. So make sure you don't miss out. Spots are limited. So go to the link in my bio in both Instagram and TikTok to make sure you register. Enjoy the show. I'm an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodhi, and on this episode, you'll learn everything you need to know about empowering yourself after purity culture. But before I get into it, I want to make a few things clear. One is that I'm not giving any type of medical advice. If you have any questions about your health, please speak with your healthcare provider. And I am definitely not giving any type of religious advice. So if you have any questions about your religion, please speak with your friendly neighborhood religious leader. And this is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So on with me today is a very special guest, somebody that I did the sexual counseling and education course through the University of Michigan with. And it is my dear friend, Sarah Hunt. And Sarah, welcome to the podcast. And please introduce yourself.
Thank you. Thank you so much for having me. So I'm a mental health and sex therapist. I'm based in West Michigan through my practice called New Bloom Therapy. So I work with individuals and couples across the whole state, mostly in therapy, but I also do in-person and online workshops as well. And I specialize, while I do general sex therapy, I also specialize in helping folks who were raised in fundamentalist religion, purity culture, and I help them recover from often what ends up being decades of self-denial, residual shame, and help them be able to embrace sexual exploration, connection, pleasure, and so that's kind of who I am and what I do.
Awesome. That is awesome. And, I remember when I first met you and you had talked about that, I thought, wow, that for a lot of people and a lot of traditions, that really resonates, right? And I think that it's not just religion alone, but it's even society, right? The way that
Yes.
we're raised in our culture and in our societies. And so perhaps you could give a little bit of background on what exactly purity culture is.
Yes. So great question. It is really broad because it is not just from religion. It's not just from one religion in particular. And even just that our country, being in the US, is founded on a lot of religious ideas and basically
values, right?
Yes, exactly. Even that word, Puritans. Basically, the short summary of purity culture is this idea of saving sex for marriage and a cisgender heterosexual marriage at that. And any sexual activity outside of that is considered dirty and shameful.
Mm-hmm. And so I just want to, we do have a lot of Muslim people that tune in. So I just want them to understand I'm not advocating for sex outside of marriage. We're just talking about purity culture in general. So I really appreciate that definition. And I think it's really important for people to understand that. So How does that play out in the patients that you see, in the people that come to you for help with purity culture, and say if they were disempowered by it?
Yes, yes. I also want to just kind of add on that I want to be really sensitive and acknowledge that different cultures, different groups have different perspectives on sexuality. And I want to be very clear that I'm not anti-religion. I'm not anti-saving yourself, for marriage. And I'm also definitely not here to tell anyone what their personal beliefs should be or what their values should be around sex or sexuality. I respect everyone's freedom to choose what's right for them. And that's partly why I'm so passionate about talking about purity culture,
Right.
because it does what you say. For some people, it comes with disempowerment and disembodiment. For
Right.
some, many people have a really positive experience with purity culture and it's really helpful for them. And often the clients who come to me are coming because they've had a lot of messages, conflicting messages. And so they come with confusion or even sexual dysfunction, pain, difficulty talking about sex or communicating with their partner or spouse. And so it looks like sort of first breaking down what happened, right? Understanding exactly where these messages are coming from, which ones maybe are helpful and which ones maybe are not so helpful. And oftentimes, as well, including a lot of sex education. Part of some aspects of purity culture is that sex education is removed from from the picture. The education is just abstinence only,
Right.
and where that can be harmful is that not everyone is abstinent.
Right.
And then when you do get married, you're like, now what? I don't know how to do this. I don't know where things are, right? And we
Absolutely.
think that sex is just supposed to happen, and that's just not the case.
Absolutely. Absolutely. And I think that when you get those kind of messages, right? So where do people then get their information, right? They'll turn to porn, or they'll look for other sources that, where they won't feel that stigma, where they won't feel that shame, where they won't feel like, they're a horrible person for just trying to figure stuff out. And then they may get the wrong messages, right? You and I
Mm-hmm.
know that, porn is often, well, usually an act. And, people that are performing in porn are actors and may not necessarily be what people want in their relationship. And that might not be the reaction that they get when they have intercourse, or, whatever it ends up being. And so they get mixed messages, I think, and it
Mm-hmm.
becomes very confusing. So I'm glad that you address this.
Yes. Yeah. Confusion, I would say, is a core theme because of the mixed messages. And a lot of what I work on with my clients is deconstructing and being able to distinguish between what are these socially constructed ideas or sexual scripts that I've been given, whether that's through porn or Disney or magazines, of all of these shoulds. You should
Right.
be this, you shouldn't be that. And which takes us outside of ourselves. And we know in terms of sexual functioning and pleasure, we need to be able to be connected to our body and in tune with our body.
Yeah.
And so a lot of it is peeling back the layers of what have I been told versus who I actually am.
Yeah. Yeah. And I think that, when you had mentioned a little bit earlier about the messages that we get regarding abstinence. And I think that, it's for Muslims, that's very important, before marriage. But I think that abstinence doesn't have to mean that you don't learn, about sex. You don't learn about your own anatomy. You don't learn, what you like, what you don't like. I think that there should be that distinction, that for a lot of Muslims, we don't have sex. We're not supposed to have sex outside of marriage. But, I think that that does get, confused with not learning at all. And then so just like what you said, people get into, they get married and then all of a sudden they just don't know the anatomy. They don't know what they like. They don't know what they don't like. And they think it's just supposed to happen and what ends up happening then is some people, if they were raised with sex negativity and if they were raised, thinking that sex is wrong, dirty, shameful, then that starts to exhibit in their bodies and they start to have vaginismus. They may have pain with intercourse. They may not understand what's wrong. And then they'll think that there's something wrong with them, that they're broken. And, all the images they see, that everybody's, completely enjoying it and tearing each other's clothes off and this and that. And that's not happening for them. So there must be something wrong with them.
Right. Right. And another part of this too, with lack of education and abstinence only, something that I've found in my own life and a lot of my clients as well, is the lack of teaching about consent.
Yes.
Because if the ideal is that you're abstinent before marriage, that's great. But then what about when you are in a position of, there's a lot of abuse that can happen because
Absolutely.
we're not taught how to say no, or we're not taught maybe where does the line end. There's a lot of different groups that have ideas about what does abstinence mean. Is that no physical contact at all? Is that no kissing? Is that, what does it mean? And so again, kind of, with the confusion, but then what happens for people who've been sexually assaulted?
Right.
Are they, that sends the message that you're used up.
Yeah. And, I think that's a very good point you bring up. And I think that also comes into play about this whole hymen thing as well, right?
Mm-hmm.
And whether or not the hymen is there. I had actually, a few months ago, I had somebody, reach out to me and ask if I could do an exam on her just because she was about to get married and she had never had intercourse before. And she wanted to prove to whoever, say her future spouse or somebody, that she was a virgin and she wanted it confirmed by a doctor. And I just thought, this is horrible.
Yeah.
It's just that one, I mean, you and I know there's so many things wrong with that whole idea, but we know that sometimes the hymen is not there. It can perforate with so many other activities, with tampons, or it can stretch it. You don't have to bleed and just so many things. And it doesn't mean anything.
Right.
And yet, it's the idea that if the hymen is not there, then you weren't pure or you're not a virgin is still so prevalent.
Mm-hmm. Right. So much shame can come from that.
Absolutely. So how do you help patients or clients overcome this? Do you have a stepwise process, or how do you start? How do you begin?
So it's really individualized based on the client and where they're coming in. Some clients have already worked maybe with a general therapist on some other aspects of their life. Some, I might be their first one. And so it really, really depends where they're at. If they're coming in and they might know that they want to work on maybe some earlier memories or beliefs about themselves, like I am dirty or I am not good enough. I do a lot of EMDR with clients. So that stands for eye movement desensitization and reprocessing therapy. It's a somatic type of therapy that helps us sort of untangle and release these core negative beliefs that we develop about ourselves throughout our life. And that can then pave the way to be able to talk through some of these really, really intimate and difficult topics.
Yeah.
So part of that is getting into the body, being able to mend the mind-body connection because of the disconnection that often happens with purity culture. The don't trust yourself, your body is bad, your mind is bad, so much just you are bad, bad, bad. And so working on how that's stored in the body. Also talking about, I do a lot of sex education about anatomy, about how to communicate with a partner about sex, how to get to know your own body. There can be a lot of fear even with touching our bodies. A lot of groups that teach purity culture or involved in purity culture will discourage from masturbation, which can cause a lot of fear from even touching our own selves. Even showering can cause a lot of fear for some people. So how to ease back in and learn to trust yourself, learn to be in your body, and again, distinguishing between what is a belief that I'm holding on to because someone told me I should have this belief, and what is it that I really believe in value because I believe in value this.
Right, absolutely. I mean, I think that, what you're talking about, there's a lot of disassociation, right, between the
Yeah.
mind and the body, and that can lead to a person allowing other people to disrespect them, to treat them badly because they're just no longer part of their body. They just don't, they see it as if it's something that's bad and, perhaps even deserves to be punished, right?
Mm-hmm.
And
Mm-hmm.
so then, if something happens to them, say, for example, there's assault or if there's rape or something like that, then they may even feel like they deserved it, right?
Right.
Because they're a bad person. And I agree with you. I think that a lot of times with some people, they may be taught that, they're a bad person and that, they shouldn't even look at their own anatomy because that's wrong and that's sinful and that and that's why so many people have so many issues with this. So I'll give you an example. I have recently had on a guest and she was talking about a group of women that she studies. She's a professor at a university here in New York, and she was saying how this woman was told by her spouse that the only way she could have a child, because that's what she wanted, was to perform oral sex on him, and that's
Wow.
how she would have a baby. I was so floored because I had, I just was like, gosh, that's so sad on so many levels.
Yeah.
And, the fact that this woman who was an adult did not know or understand her body, she had no idea. She she gave all of her power up to her partner, and her partner then used that for his own pleasure and used that against her. And it just really made me think, like how much work there needs to be done to empower and educate others so that we all have the same knowledge, even if it's just basic knowledge about our bodies. And for her to understand that she has control and that she's the one, that can decide when to have a child and if she understood her own cycle and menstrual cycle and all of that. So there's so much there, but really sad, I think, when I heard that.
Yeah. That's heartbreaking
Yeah.
to to not have the education about your own body to be able to make an informed decision.
Yeah. Yeah.
Mm-hmm.
Absolutely. Absolutely.
And that also, I guess, is adjacent to that many women in purity culture are taught that it's their job to sexually satisfy their husband. And something that I know I heard a lot growing up, and I hear others have had this experience as well, is that we're taught that men are uncontrollably ravenous sexual beings. And as a man's wife, if you are not sexually satisfying him enough, then he may cheat on you or go outside the
Mm.
marriage. And that means you weren't satisfying him enough. And so
Wow.
taking the responsibility away from the man, because he can't help it, is the message. And so this
You're just a
idea,
crazy animal, right?
right, right, exactly. So talk about pressure, also
Yeah.
just inaccurate responsibility in terms of being responsible for our own bodies and our own behavior and decision.
Yeah.
And it also can reduce a woman to believing that her worth is in what she can offer sexually or her body.
Right. And also saying that, like men have no self-control. Like this is just, they're just crazy. And it's
Well,
just all up to the wife to like reel him in and keep him satisfied. And, that
right.
way he won't look outward, placing no responsibility at all on the partner, right?
Yeah.
On the husband and
Mhm.
all the responsibility on the wife. And if he goes outside of the marriage, it's her fault.
Right.
That's, that's
Right.
amazing. Yeah, that's
There's
really
one, there's a saying that men are taught in purity culture that their minds are bad, and women are
oh,
taught that their bodies are bad. And
wow.
so a lot of my male clients will come in and they have trouble with their sexuality, with their sexual health, because when they go to engage in sex, they shut down because they feel there's these, intrusive thoughts and deep messages
Mm,
of it's wrong to want to be sexual, even after you're married,
wow.
and feeling dirty and shame for having these sexual thoughts. And then also with that, because we're taught that men are the one who have the sexual thoughts, if you're a woman and you have sexual thoughts, then what's wrong with you? You shouldn't want sex. You owe sex to your husband, but you shouldn't want it.
Wow. Yeah. It's amazing. I would think that also with a man, if he's coming in and having all those intrusive thoughts, I'm sure it affects his erection and premature ejaculation and all of that stuff, right? Because men are so performance focused. And if they're not able to focus on that performance, I'm sure it really inhibits what's happening for them. And if they're not able to be in their own body because they're so preoccupied with all these other thoughts, then it's probably going to make intimacy very difficult.
Right. Right.
Yeah. So what would be like a beginning step? What would be some ways that somebody could start, overcoming all of these obstacles that they may have been raised with? What would be, definitely seeking out a sex therapist that is trained in this. And of course, I'm sure after listening to this episode, everyone's going to be wanting to go to you, but what would you say is like a good first step?
A good first step, if you're listening to this episode, that's a great first step. Really learning, I would say, seeking information and education from a variety of sources um, that that helps you, one, know that you're not alone because of the shame element. So many of us can feel really alone, and because also we weren't taught how to talk about sex,
Yeah.
and also that really we shouldn't have to worry about it, especially if you're not married. Why would you need to talk about sex? And so we
Right.
don't know who to talk to.
Correct.
So realizing that you're not alone through whether that's through listening to podcasts or there's a lot of different forums or groups online that have like purity culture support. And along with that, sort of tied with that step, would be recognizing that it's not your fault, that
Yeah.
whatever you're struggling with sexually is not your fault. It's
Yeah.
not that something is individually wrong with you. It's
Yeah.
likely you were given misinformation or a lack of information and a lack of support, because sexual health is such a huge part of who we are as humans
Huge. Huge.
that we need support in. It's not something that we can figure out on our own.
Yeah. Yeah. Absolutely. I think that, speaking to therapists, and I know I mention this all the time, therapists are like the best. You always, you have the best language. You're always holding space. I never even heard of that phrase till I met all of, the therapists and the sexual counseling and
Yeah.
education coach. Right? They're always like, oh, it's good to, I'll hold
Mhm.
space for you. I'm like, what the heck is that? What is holding? But, I think it's so fantastic that it's I think everyone needs a therapist, everyone needs somebody that can hold space for them. And I think that when you've experienced trauma or all of these beliefs where you think that everything is wrong with you, and perhaps you feel like you're going to hell, or if there's a heaven and hell for you and you think you're going to hell because you've had these thoughts, it's so important to speak to somebody like you who can help to disentangle those thoughts and say, and help people appreciate themselves, right? And love themselves. And I always say this to my kids, just in general, is that, if you don't love yourself, how can you expect others to love you? And how can you give love if you don't love yourself, right? And I think that people that may have been raised in purity culture and that have a lot of self loathing and guilt um, may feel that they're not lovable and that they don't deserve to have somebody that will respect them and love them, and that however somebody treats them, whether it's bad or whether their previous partner was cheating on them or whatever, that's what they deserved, because they're just this bad person and they don't deserve to have the type of love that they've always wanted.
Mhm. Yeah. Yeah, that's a great point. And even something you said reminded me that even before any of the other things that I said, probably the most important first step is to give yourself permission to believe that
Yes.
this matters,
Yes.
that your sexual health matters.
Absolutely.
And part of that as well includes grieving the loss
Mm,
of what you can't get back,
yeah.
grieving what has happened because of the misinformation or lack of information. And
Yeah.
so holding space for, for clients is a
Mhm.
lot of what I do in the beginning too, is letting them know, hey, this matters. And it's okay to grieve this. It's important
Yeah.
that you allow yourself to feel how you feel, because the
Mhm.
more we suppress how we feel, that's got to go somewhere. That energy just doesn't go away, right? That's what comes out as different mental health symptoms and concerns that people end up coming in with, because they're sort of at their, you know, they don't know what else to do. And another aspect of this too is letting them know, giving them permission to talk about it. And so
Yes.
when clients come in and I say the words masturbate or penis or vulva, even hearing someone say those words without shame can be
Yeah.
a really reparative experience for someone, letting them know, oh my gosh, like who I am or something that I have in my body can be said out loud, right? It
Yeah.
takes the shame and um, embarrassment out of it.
You probably see them, even like their body probably relax, right? When they allow themselves. I'd love to add one more thing. So you said, giving themselves permission to grieve, to experience this, but I'd also love to add, like, giving yourself permission to experience pleasure, right? And that follows after you've been able to come to terms with this and know that you're not bad, know that there's nothing wrong with you, that you're not an awful person, and that this is your sexual right to experience pleasure.
Like,
And as you and I both know, Emily Nagoski, her new book Come Together, she says pleasure is the measure, right? So when people often, I guess, will ask her, like, how often should couples be having sex, or what should people do, and all these shoulds,
yes,
she says she focuses on pleasure. And I'm
right.
sure that that's probably something that your patients eventually get to, right? But first, they
Mhm.
have to work with all the trauma and allowing themselves to process what they felt and how they felt about themselves, and then
Mhm.
eventually getting to that point.
Right. Right. And it's a tricky process, because oftentimes people come in and they're very goal oriented, solution oriented, which is fair. And having that goal orientation towards sex, if it's related to performance, that is really the opposite of what your body needs in order to quote unquote perform. Right.
Right.
And so
Right.
helping clients in the beginning recognize that the first step will be to accept where you're at, and
Yeah.
that self-compassion and self-acceptance, like you said, permission for pleasure needs to come first. And even before pleasure, there's the even just neutralizing it, because it's a big
Yes.
jump to go from this is bad to this is
Yes.
good. And
Yes.
so oftentimes we'll spend a good amount of time neutralizing these things that we're afraid of.
Yeah. Yeah. And you know what? I mean, I think that also in couples where perhaps, one has a higher libido and one has a lower libido, right? The person with the higher libido, may have been, I don't want to say ostracized, but maybe, you know, told that there was something wrong with them because they had the higher libido. The person with the lower libido would be like, oh, why do you have such a high libido? There's, perhaps there's something wrong with you that you have such a high
Mhm.
libido, and, make them feel shameful and bad and guilty because they have a high libido. And I would counter and say that, that's for that individual, it's normal, right?
Mhm.
And to have somebody else make them feel bad. Again, I think that goes a little bit with that purity culture, right? Like women shouldn't have such a high libido, and why do they have a high libido, and what were they doing in the past, and what's wrong with them,
Right.
Um,
Mhm.
I'm curious what your thoughts are on that.
Yeah, and I totally agree. And the same goes for oftentimes, people will come in with a low libido and think that that means something's wrong with them.
Yeah,
And they come in because they want to fix it.
yeah.
And I really appreciate what you said at the end there with um, people wondering, what have you done in the past that may have caused this? Similarly, when people are experiencing sexual dysfunction or just their sexuality in a way that they feel is wrong or not okay, that can, if they have been told that if you are pure up until you're married, as in not sexual, up until you're
Mhm.
married, then you will have a beautiful, wonderful, stress-free sex life with your spouse
Forever, ever, ever, right?
forever and ever. And when that doesn't happen, then there can be blame or questioning of, if it's not amazing, that must mean that you must have sinned
Yeah,
before marriage. If it's not
yeah.
amazing, it's probably because you're being punished for sexual sin outside of marriage, which is just so heartbreaking to me,
Yes.
right?
Yes,
Ugh.
absolutely, absolutely. All that, the guilt and the shame and the punishment, right? Always that you're gonna burn in hell
Mhm.
because
Yeah.
of what may have happened or what may not have happened, even if that person was never sexually active, and all of a sudden they decide that they enjoy what they're doing, or being physically intimate and stuff, and then all of a sudden they're reprimanded by their spouse and saying, well, there's something wrong with you because I don't have as high of a libido, and because you have such a high libido,
Mhm.
then there's definitely something going on there, when there in fact maybe nothing. It
Right.
could just be that
Right.
somebody has allowed themselves to experience pleasure, and they enjoy it, and
Mhm.
there's so much there. And I think that I'm so glad for people like you that can help so many people that are experiencing this guilt and shame, and
Mhm.
really prevents people from enjoying their sexuality, which we know is such a huge component of our lives, right? It's almost
Mhm.
a barometer. I've heard people say that it's a barometer of a relationship, right? What's going on. And I always say that whatever's going on inside the bedroom is also going on outside of the bedroom, right? If you're not talking to each other, if you don't have communication, if you're stonewalling, if you're, just all of those things are, of course, going to be happening inside the bedroom, and you're not going to like what's happening inside the bedroom. And then you're going to try to find a quick fix. But it really boils down to, are you feeling safe with your partner?
Mhm.
What type of relationship do you have with them? Are you emotionally connected? What does that look like? Is there communication? Are you talking
Yeah.
about things, right?
Yes, definitely. As a sex therapist, and I don't know if you get this too, as a just in all of the work that you do, when people hear I'm a sex therapist, they go, oh, okay. Like they think it's this, I don't know, raunchy thing. But and they'll ask me like, what's your best sex tip in the bedroom? And my best sex tip is communicate,
That's
talk
right.
to each
That's
other.
right.
And
That's
that
right.
includes being really honest with yourself
Yes.
too.
Yes.
not
Uh,
just communicating, the bare minimum, but being really honest with yourself and with your partner. It's the
yeah.
sexiest thing you can do.
That's right. That's right. I think that I don't get that as much because, as soon as you add the word medicine to
Yeah,
anything, it becomes not as sexy. And I think that, but yeah, absolutely. I can see, that I'm sure that you get that a lot of, what's the number one tip you give? And there's been so many studies that have shown that, right, that communication is the one factor that is the one most important factor that leads to women specifically in the study that I read of having sexually satisfying encounters was communication, setting boundaries, consent, all of those things that perhaps you talk about before you start to become physically intimate with somebody, because then that kind of sets the stage. And then if you're with somebody that's not able to have those type of discussions, then perhaps you shouldn't be with them, right?
right.
Somebody that can't respect you, somebody that can't understand where you're coming from
Mhm.
and the things that you like, things you don't like.
Right. Well, and the tough thing too is if your partner doesn't want to have those conversations, it might not even be because they don't want to, but they might not know how to because they probably weren't
Yes.
taught either. And there's
Yes.
so much fear in seeming inadequate for in front of your partner, even if they're the person that you're closest to. We still don't want to seem inadequate or not enough. And so rather than
100%.
communicate, we avoid. And that's when people end up oftentimes years after those attempted conversations in couples or sex therapy.
100%. You are so right. Is that anytime, right? Somebody says, "Oh, we need to talk," automatically you're like, "Oh no, what's wrong? There's something wrong. What's going on? You know what? Why do we need to have a talk?"
Mhm.
Um, and so I think maybe trying to bring it up when, neither of the individuals are tired or exhausted, and maybe even when you're out taking a walk or something like that, something that's very, low stress, and then
Mhm.
bringing up perhaps a difficult conversation is a little bit easier than, when both individuals have come back and they're both stressed out and they're both, tired from work. And then you have that conversation. Or actually, I think the worst time to have that type of conversation is in bed.
Right.
Like, oh, by the way, this is what I've been
Mhm.
thinking.
That
It's a real killjoy, isn't it?
Yes. Or even right after sex to be talking about what is not going well. That's really going to encourage your partner to want to have sex again.
Exactly. Exactly.
Yeah.
Absolutely. So,
privilege.
those are some key tips to anyone that's listening. Avoid those pitfalls. Do
Yep.
not have a conversation right after sex to tell your partner what's wrong with sex.
Right. Right. Another tip that I often give, well, I guess it's less of a tip and more of a process, but when people come in experiencing dysfunction, and even that word, I
I
often
know,
hesitate to use, or I try
right?
to help. Yeah.
It
I
means
try
like
to
there's
help
something
clients.
wrong, right? There's something wrong. There's a dysfunction, like you're not
Mhm.
normal.
Right. Exactly.
Yeah.
So I work to help clients reframe that from
Mhm.
if your body is not responding how you want it to respond. I don't know if you've talked about like arousal non-concordance on the podcast
No, but
yet.
I love that. I love talking about it. So let's talk about it.
Sure. So basically, arousal non-concordance is when your body and your brain are doing different things. So that
Yeah.
might look like you are feeling sexual desire, you are wanting to be sexual, but you're for women, that looks like you're not getting wet, or for a man, not having an erection, or vice versa. Maybe you have an erection or you notice pulsating in your pelvic region and you're not feeling sexy, or you're seeing something that's actually disturbing to you. And those experiences can be so frustrating and confusing and scary for people. And um, it's important that we talk about it and understand that that is a thing. That's a thing that happens, that our brain and our bodies don't always align.
Coincide. Absolutely. I love that. And I think that, I think it was actually in Emily Nagoski's book that I read where she talked about an individual, a college student, a male college student.
Mhm.
It was in that, right? Where she
Yes.
talked about
Yep.
that, how he saw a sexual assault and he noted that he was having an erection, but he disliked what he saw, but he was so confused with what his body was doing that he thought that perhaps he was enjoying it when he wasn't enjoying it.
Mhm.
And so he never reported the assault and then felt so guilty that he didn't because of the way that his body responded. And same thing with women, right? When they are being assaulted, they may notice increased lubrication
Mhm.
and they don't like what's happening, but it's just that it's a physiologic response that's responding to a sexual stimuli that's happening. And it doesn't mean that her mind is into it. It just means that the body is responding. And vice
Mhm.
versa, say that she wants to be intimate with her partner, right? Wants to be sexually intimate and she's not. It could be because of menopause. It could be because of perimenopause. It could be so many reasons why she's not lubricated down below, but
Mhm.
she wants to be sexually intimate. And so again, that same frustration happens where, the body and the mind are not aligning and patients and clients can't figure out what's going on. So I think I'm so glad you
No.
brought that up because I think arousal non-concordance is a very real and very important thing.
Right. Right.
Yeah.
And rather than blaming ourselves or feeling that something's wrong with us, I encourage people to get curious. If
Yeah.
something's going on that you don't understand,
Yeah.
let's dig deeper, right? What might be going on? What might your body be trying to tell you? And there's a lot that we can find out when we ask our bodies questions.
Yeah, absolutely. Absolutely. So, well, this has been such a great discussion. I feel like I could talk to you forever, Sarah. It's
I,
so good. I'm so glad we were able to do this episode together. So, for everyone that is listening, one, before we go, I'd really love to hear what is your, say, like your one pearl that you would love to say to people, your take home message for anyone that's listening, for trying to kind of move past purity culture or feeling bad about it. What advice would you give them?
so this is actually, I think, very similar to like Emily Nagoski's main message in her book, Come As You Are, but I believe it so wholeheartedly that there is absolutely nothing wrong with you.
Yeah.
And what's interesting is that sort of goes against, people are coming to therapy because they often think something is wrong with them.
Yeah.
And I am really wanting them to believe there is absolutely nothing wrong with you. I'm happy to, be here and support you and walk along this journey with you as long as you need. And I will believe this for you until you can believe yourself that there is absolutely nothing wrong with you.
Yeah. I love that. I love that. That's so great. And so, for everyone that is listening and wants to hear more from you and follow you, how can they get in touch with you? How can they follow you?
Yeah, so I'm most active on Instagram. My handle is You Bloom Therapy. So that's YOU Bloom, like the flower, and therapy. And my website is the same, youbloomtherapy.com.
Amazing. So, well, thank you so much for coming on, Sarah. I love this talk. I think it's so important. And I hope lots of people listen to it because I think that there's always hope. And I think that there's always so much shame and
No.
stigma around sex education and what we were taught and what we weren't taught. That, it's really important to kind of process all of the information and then figure out how we can move forward. So thank you for
Yes.
coming on. And well, this has been real and really intimate. And again, this is not meant to be any type of medical advice. So until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.